Welcome to Natural Beauty Summit's Love and Babies, a Health Journey. I'm your host, Salome Sallehy, founder of Sugar Wax, and I'm excited to be kicking this year's summit off with my co-host, Angela Cheung, founder of Emdash Beauty. Now, before we get into our wonderful guest, Angela, will you give us a little bit of an intro?
Absolutely. My name is Angela Cheung. I'm the founder of Emdash Beauty. Emdash is a line of skincare serums that is made for mothers. I struggled a lot when I was pregnant and postpartum with my own skin. I struggled to find a line of skincare that was both clean, yet practical, and yet still very clinical and dermatologist tested. And so I created Emdash to fill that need. And so hopefully all you mamas out there get a chance to try our products.
And if you don't know about Sugar Wax, we're an at-home sugaring hair removal wax system. And if you want to learn more about it, go to sugarwax.com. And for Emdash, go to
emdashbeauty.com.
emdashbeauty.com. Awesome. All the links will be provided for you guys. Now, our very first guest of the summit is Dr. Aimee, who is also known as the Egg Whisperer. And I'm really excited to be talking to her. But first, Angela, tell us a little bit about Dr. Aimee.
Absolutely. Dr. Aimee is a fertility specialist, also known as the Egg Whisperer. She's known for her personalized approach to fertility care and is the developer of the Tushy method, which screens for the most common causes of infertility. In practice for over 15 years, she specializes in IVF and helping women over 35 realize their dreams of becoming mothers. Dr. Aimee has been featured on NBC, CNN, Fox, The New York Times, Forbes, NPR, and Glamour.
And I really like Dr. Aimee's approach to fertility because it goes so much beyond the medical. There's lifestyle, nutrition tips, and just if you want to get into if you want to get a really good glimpse of what it feels like to feel fertile, this is the segment for you. So stay tuned for my conversation with Dr. Aimee. Hello, everyone, and welcome to Natural Beauty Summit's Love and Babies, a Health Journey. My really, really special kickoff guest for you is Dr. Aimee, who is a fertility specialist. And, given that the summit is all about love and babies, this is one of the most fascinating scientific areas of babies that we've ever experienced. So I'm excited to be talking about some cutting edge stuff with Dr. Aimee. So welcome to the show.
Thank you, Salome. I'm so happy to be here. So excited to talk about love and baby making.
Yay. Well, I'm excited to have you. And I just want to dive right in because, there's so much information out there. You can Google all you want, like, should I do this? Should I do that while I'm trying to conceive or whatever? And I want to start talking about weight, actually, because this is something that's not very much talked about. Because, a lot of us, as we're going into pregnancy, you're going to gain some weight. So do we try to lose weight before we conceive? Do we want to gain weight? I mean, obviously, it depends. But I would love for you to just speak to the whole concept around weight, fertility, and conception.
Absolutely. That's really easy for me to do. I talk to my patients about their lifestyle in almost all of my new patient consults. And weight is a very personal thing. And I find that I have to be very sensitive around how I talk about it, because most people know that if you are, curvier, then you might have a harder time in pregnancy because of links to preeclampsia, preterm labor, preterm delivery, hypertension, and diabetes. But a lot of people actually don't know that.
No,
and so sometimes So
what's curvy? Define curvy.
I would say even a BMI over 30 could put you at risk for preterm labor, preterm delivery, which are the leading causes of autism. I don't think a lot of people realize that. And so that's why if you actually Google BMI autism risk, you're actually going to see it's not so much like BMI of 30, but even the higher BMIs over 35, over 40, that there is an association. Some studies have shown even 40% increased risk of having a baby with autism because of body size and a much higher body size. And so I think a lot of that might also have to do with other things like diabetes, hypertension, and preeclampsia. So it may not all be body size, but I think the body size is probably contributing to those risks when it comes to that.
I have to ask you, does preeclampsia still happen? Is that a thing? I feel like that's something that I would see in like old movies, but like, is that a thing?
It is. You would think that in 2023, we would have found a cure and a test to even, catch it even before it becomes a thing. It is the leading cause of maternal mortality in this country. And it's very dangerous, and you're at higher risk. The larger your body size, but also if you have other chronic medical conditions that go with that, which sometimes also go with being overweight, which would be like high blood pressure, diabetes, as well as advanced age. So if a woman, especially over the age of 40, especially if it's her first pregnancy, can be at a much higher risk of having preeclampsia. People who use donor egg, donor sperm, donor embryos, when it's not your own DNA or DNA that you've been exposed to, you're at higher risk of having preeclampsia as well. So it's very much a thing. It's very dangerous. And it's really sad when you have to, let's say, treat a woman for preeclampsia and the treatment is having her deliver a baby before it's ready to come out. And so that's one of the scary things that can happen, and why we take lifestyle considerations very seriously. So if you're thinking about pregnancy, do a pregnancy readiness visit with your OBGYN and go through all the medications you're taking, the lifestyle you're leading, your body size, look at your blood pressure, your blood sugar, and then come up with a plan to be the healthiest version of yourself. And I have a little trick, not a trick. It's not a trick. I have a little thing that I do with my patients. I call it the 10-minute rule. My 10-minute rule is I need you to be able to run a mile in 10 minutes. If you can, then you're fit for pregnancy. If you can't, you need to rethink, what's going on, how fit you are, and see, if you can get there. Obviously, not everyone can run due to some, maybe some physical limitations. But if you're someone who is physically able to do that, that might be a good rule of thumb.
Okay, that's great. But I need to back up for a second, because for some of the people in our audience who aren't familiar with preeclampsia, can you define it for us?
Yeah, it's a hypertensive disorder in pregnancy, and it's caused by pregnancy, and the cure is not being pregnant. And it can happen as early as 20 weeks of pregnancy, and sometimes it can be managed for a short period of time, but it usually develops from mild to severe in a very short period of time for some people. The symptoms can also include severe headaches, visual changes, right upper quadrant abdominal pain. And the worst complication of preeclampsia is when you actually have an uncontrollable bleeding that can't be controlled, and sometimes that can result in the need for a hysterectomy as well as delivery of the baby.
Oh my goodness. Okay. So there you have it, guys. That's a lot. That is a lot. Now, I want to talk a little bit about fertility challenges, because as a fertility specialist, you see women who are, at every stage and age and trying to get pregnant, and are obviously coming to you because they feel a challenge. So can you talk about what are some of the more common and maybe some of the lesser known challenges that you see in women between age of 25 to 35? And then separately, let's talk about 35 to 45. And, this isn't ageism, guys. This is just, age is definitely a function of pregnancy and fertility. So can you talk about those two group sets?
Yeah, I mean, I think it's, for younger people, it could be something still like, an egg quality issue. So 10% of women, even in their early 30s, might have eggs that are acting chronologically older than they actually are. So, I mean, just because you're 25 doesn't mean that, you have the egg reserves of a 25-year-old. There's some 25-year-olds that might have conditions like Fragile X or a translocation or severe endometriosis. So I always tell people when you're young and you're not getting pregnant right away, you should definitely go see a specialist because that's not typical. Like most young people should be getting pregnant within 6 months of trying. We usually say wait 6 more months, so a year. But if there's a reason why you're not getting pregnant, finding that out sooner than later could be helpful. So some of the more common reasons for someone who's 25 to 35 would be PCOS. So that's an ovulatory disorder, having tubal blockage. So when the fallopian tubes cannot be the embryo transport system for you. Male factors, so having a low or absent sperm count, that can also be a contributor. Endometriosis, I think, can also be a cause of infertility in younger people, as well as fibroids and other uterine issues as well. For older folks, for older patients, and I usually see more patients over the age of 41 than under 31. But for my older patients, it usually just has to do with the age of the egg. Certainly, as women get older, men get older too. And most women aren't like J-Lo, or I should say Madonna, dating a guy 30 years younger. Most of us, date within our age range for the most part. And so typically if a guy is older, then he might also have problems with his sperm. The older a guy is, especially over the age of 50, the higher the likelihood of having sperm that would cause an embryo to have chromosomal issues, and also issues like autism and other, psychiatric diseases like schizophrenia. So that's kind of the difference between, women who are older versus women who are younger.
Now, when you say egg quality, I mean, I know you talk a ton about like lifestyle factors that, can help with egg quality. What can the younger cohort do about to improve their egg quality? Assuming that whatever other issues that they might have, like PCOS or endometriosis, has been addressed or is in the process of being addressed. And what about the other cohort? What can the older women do to improve egg quality? Are they different things or is it the same thing?
I mean, it's about the same thing. I mean, I like to think of egg quality as unfortunately not something, I'd like to think of it as something we can improve, but the reality is really just something we can support. This concept of improvement just makes us feel like it's in our control, and it really isn't. Our egg quality is, basically related to our age, our genetics, and our environment. You can't control your age, you can't control your genetics. The only thing you can control is your environment. So the environmental factors that you can control are, what you expose your body to as far as chemicals, cigarettes, marijuana, heavy drinking, stress, sleep. And then there's also some supplements that may help, like CoQ10. So whether you're 25 or 45 trying to have a baby, I think the same rules apply to both groups of women. However, there might be some things that we can offer women, like ovarian PRP. So that's the injection of platelet-rich plasma into the ovaries. We're learning more and more about it. It's something that I offer in my practice, and that might help increase the egg count of someone who's, let's say, over 35 trying to get pregnant. It's not necessarily something that we do unless you're considering fertility treatment, but I have had patients do it and then go on and get pregnant unassisted.
Okay. I want to kind of go back to the weight question because, you're talking about lifestyle and, we're talking about all these conditions. Now, is weight gain or loss something that you ever recommend to your patients as they're getting ready for, is that how does that work into fertility?
Absolutely. I mean, I think in order to have a really successful procedure, your doctor needs to be able to access your ovaries. And if your BMI is really high, it's very hard to bring the ovaries down to where you are able to actually retrieve eggs. So I've had patients with a BMI, let's say over 40, and they share stories where the doctor couldn't even access their ovaries and they didn't get any eggs retrieved. And that's really disappointing. And no one told them that that's why. So, but at the same time, you can have a patient whose BMI is over 40, but her ovaries are really easy to access. So I think there aren't two patients the same size, they're going to have the same story. So I feel like there is definitely a role for weight loss if your BMI is over, let's say, your clinic's cutoff, because a lot of clinics do actually have a cutoff for BMI, and it tends to be between 38 and 40 in the San Francisco Bay Area. In other parts of the country, like for example, Texas, it might be a little bit higher, like closer to 50, but that's just because their operating rooms are prepared to take care of women in that body size range.
Now, we hear a lot about women needing to maybe gain weight to regulate their hormones prior to pregnancy. What are your thoughts on that?
Yeah, so there's a condition called hypothalamic amenorrhea, and this is a condition where women are usually exercise enthusiasts, and they exercise a lot, or they calorie restrict. And so their BMI tends to be under 19. And so sometimes if you suggest to that patient that she decrease the intensity of her exercise, maybe gain a little bit of weight, she may not need my help to get pregnant, and she might start to ovulate, or at least she might respond better to medications by doing those things. Sometimes, when you're exposed to such chronic, exercise like that, even changing your lifestyle doesn't always help. You might always have irregular periods and not ovulate, but it might be worth considering, if it means getting less treatment or making your treatment more successful, sometimes gaining some weight could be helpful, and something that we discuss with patients too.
Now, when you have patients that, let's say that they are in that sweet spot of like 20 to, let's say, 35 BMI, right? But like as a culture, I feel like so many of us are thinking about like, oh, like I need to lose that last 10 pounds or whatever it might be. Is that something like, do you encourage or discourage any like maybe short-term intensive dieting for like that cohort who's already in the safe spot?
Not at all. I just encourage eating the rainbow, foods rich in folic acid, omega-3s, CoQ10, N-acetylcysteine, vitamin C, A, E, getting good sleep. I mean, I think that's what's important, not losing the last 10 pounds that you think you need to lose and when you really don't.
Totally. Okay. I love that. Now I want to talk about treatments because that's what you do. And there is like a whole new array of fertility treatments. What are some of the newer treatments that you provide, and how are they better or more effective or efficient than maybe something that we did like 5-10 years ago?
I wish that, excuse me, I wish that I could say that there is something that has been invented or better or new. And sadly, there isn't. There is this dream that I have of like doing IVF without an egg retrieval. Like, how can we retrieve eggs without putting a woman on hormones and shots? And like, there has to be a better way. But unfortunately, things are just pretty much very similar to what I did, let's say 15 years ago when I started my practice. The difference is that, maybe the incubators are better, the media is better, the genetic testing platforms are better, but we're still taking care of patients in much of the same way. And I think that's a really important point for people to really learn and think about, because I think people think that I'll go to the fertility doctor and she'll fix the issue no matter how old I am, and I can wait. And then, she does the treatment and I'll be pregnant. And the reality is, like, we can only work with the DNA that you are bringing us. We can't change it. So I think people read online like designer babies and, mitochondrial DNA, mitochondrial replacement technology and 3-parent babies and all this kind of stuff. And the reality is we're still just doing IVF with sperm injection, culturing the embryos to blastocyst stage, doing a biopsy, genetically testing them, doing some testing before we transfer, and then transferring the embryos. So there are some little gadgets that we're using now, but those gadgets I wouldn't say are like, the next big thing. But I think what's exciting for me is that more women ever are considering egg freezing and are doing it. So hopefully, 20 years from now, those 20-year-olds that are ready to have their babies, they won't need to use an egg donor. They will be their own egg donor instead. So I'm seeing changes and trends in fertility, treatments and what people are doing, but the actual treatments are pretty much the same. Fertility pills, IUI, fertility shots, IVF, egg freezing, embryo donation, egg donation, sperm donation.
Okay. And for someone who is like in our audience and they're in their 20s and they're not even thinking about kids right now, can you talk about like, what is the tipping point? How does someone decide like, oh, I should freeze my eggs?
Yeah. So I would say if you're thinking that maybe there's at least a 50% chance that you might want a baby in the future, I think getting your levels checked, talking to a fertility doctor about your personal story and how old you think you might be when you're going to have that last baby. I think egg freezing can help with that. And I think that not enough married people actually think about egg freezing as a way to grow their family down the road either. Same thing with embryo freezing. So I tell young people, look, get your levels checked, see what's going on, talk to someone about your family history, talk to your mom about how old she was when she had you, and if she had any problems, if she had early menopause, get your levels checked maybe every 2 to 3 years. And then depending on your levels and what your goals are, maybe freeze your eggs by the time you're like 28 to 32, and that range seems to be a good range.
Okay, that's a great tip. Now, for people who are coming to you and, they've had everything checked, or you, I guess you're doing the checking, right? And they fall within all the normal things, and, their mom didn't have early menopause, or let's say that they're struggling with hormonal balances. What do you find is like causing that? Is it lifestyle? Is it weight? Is it like exposure to toxins? Is it stress? Like, what are the things that you see more commonly? And what are the things that you see and you're like, how did that even happen?
I mean, I find that endometriosis, I'm seeing more and more of, and it causes inflammation in the body and it can affect egg quality. The hormonal imbalances can be thyroid, prolactin imbalance. It could be from having high testosterone, high blood sugar, and that can be due to PCOS. So we see that a lot. So hormonal imbalances are actually, quite common in my fertility patients. And I try and diagnose and treat them before we do treatment. But there isn't usually like, I've never seen this before type of thing. Most things are pretty explainable with luckily with what I do.
Okay. So there aren't anything like you've been doing this for 15 years. Are there things that you're seeing more of now than you were like at the start of your practice?
I'm seeing more 50-year-olds wanting babies, and I predict that my kids are going to have their kids when they're 50. And that's going to actually be a thing. 50 will be the new 40. And so, oh, yeah.
Really?
Oh, absolutely. It's not unusual for me to see at least one 50-year-old a week. I would say I probably went 10 years in my practice without ever having a 50-year-old reach out asking to get pregnant. And so now it's very common for my patients to be over the age of 45. So that's definitely a new trend that we're seeing.
And what do you think? Like, is that group? Because that wasn't even part of my consideration when we started this conversation. Because I guess I don't know too many 50-year-olds that are wanting to have babies, or maybe they're just not telling me. Um, it is a very personal choice, but like, what's causing that? And does 50 propose like new challenges that you aren't faced with in like 40 age range?
Yeah, I mean, I think like everyone else, they just realize all of a sudden time has passed by and now they're 50 and they still want a baby and they didn't have time to do it. That's usually what they share with me. And now they're ready, they're financially ready, they have the time to do it, and they have passed my 10-minute rule, or they basically satisfy it. They can run a 10-minute mile.
Yes.
And these women are just like incredibly fit. You wouldn't even know that they're 50. And that's how they can do it. I've had a patient come to me at 50 and come back at 52 for her second baby. No problem. But absolutely, it can absolutely put you
Do we
at
have
risk.
eggs at 50?
Oh, no. They're achieving this through creative family building.
Okay.
Yeah.
Gotcha.
Yeah. And
Okay.
but I
So
think that the 20-year-olds of today will have frozen their eggs. And so they're going to use their 20-year-old eggs when they're 50s. They're going to be using their own eggs.
is there an optimal time to freeze your eggs? I mean, I know they talk about like, 26 being kind of like the perfect fertility age, but is there like, what's your ideal range?
I mean, ideally, it just depends on what your genetics are, right? I mean, you would know that because if, let's say, your mom went into early menopause at 30, even 28 might be too late for you. So that's why doing a check-in by the time you're 25 with the doctor and then seeing what your levels say, what your history says in terms of your family, siblings, if your mom needed IVF to have you, you might want to do it earlier. But I think 28 to 32 seems to be a good range for most people.
So you've earned this name, the Egg Whisperer. And I kind of want to ask you like a different kind of question that we usually don't ask doctors, but like I feel like you have almost this other sense for fertility. So can you talk about like what does it feel for your patients to be fertile? What is that feeling? Like, how do you know you're fertile? Like,
Yeah, I mean,
is
I
it
think
an energy? Like, what is it?
I think it's just having hope in your heart and being open to all possibilities. So even my patients who end up using an egg donor, they feel fertile. They feel like they can do it. They feel like they want to be a mom. And so I see fertility in like every single person I meet, even my friends who are in their 50s who call me for other advice. I'm like, oh, so you want a baby now? I'm like, no, Aimee, stop it. I'm calling because I want to see if you want this painting and I'm going to sell or something. Um, but yeah, I mean, I think it being fertile and feeling fertile just means like you feel young, you feel the energy, you have that passion that you like want. But I think it's also like you have this view of the world that's positive and you want to contribute to it through the love that you're going to give a child. So there's no better way, I think, to make our community and this world a better place than raising really strong little humans, right?
Love
So
that.
we're seeing a little bit of a shortage of that, I think. And so whatever I can do to fill this world up with as many, families as I possibly can, I'm going to leave this world a better place.
Oh my gosh, I love that perspective. Oh, I would love for you to. I think that the approach that you take with your patients is so multifaceted. And I think that that's what's really different. Well, with you, not with everybody, but I do feel like this trend of like looking at patients more holistically is catching on. So, can you share with our audience some tips for fertility, whether it's like preconception or during pregnancy, to just really optimize that? And I love starting it with that hope and that vision of like yourself as a mom. Like, I love that. I think that's step number one. But what are steps 2, 3, and 4?
I love it. Well, they're easy. I mean, I have the Tushy method for a reason. So for people who are thinking about getting pregnant, I recommend doing what I talked about earlier, a pregnancy readiness consult. It doesn't have to be with a fertility doctor, but I've created the Tushy method to make the steps really easy. So what that means is getting your tubes checked, especially if you've had a history of chlamydia or gonorrhea before, getting an ultrasound of your uterus to make sure there isn't a fibroid that's blocking the way, checking the sperm, doing the hormone testing. We talked about hormonal imbalances, like ruling out PCOS, for example, and then looking at your genetics, making sure that you and the sperm source or sperm provider, your partner, for example, or a sperm donor don't share common mutations for similar genes. So those are the things that I recommend everyone does pre-conception, just to figure out, like, do I have to, think about seeing an IVF doctor to have my babies? And sometimes people don't find out like a year into trying that there's no sperm. Like that should just never happen. There's so many easy ways of getting your sperm checked. And then in pregnancy, same thing. Like make sure that you're seeing a doctor and their priorities are yours. No, that's the opposite. You want to make sure that your priorities are theirs. I had a hair tickling me, so I got distracted by a piece of hair. So you want to make sure that your priorities are theirs and that that you're getting all the tests, that you're, making sure your blood pressure is normal, that you're doing the glucose check, and they're treating you like a person and you're not being treated like someone that doesn't matter. Every pregnancy is VIP, very important. And if you aren't getting the care that you need in pregnancy, you just got to speak up because you don't want to have someone say, well, next time we're going to do this to save your baby. It's like, who says that? But I've heard those things before and they kind of make me a little passionate about educating people about how to advocate for themselves.
I bet. And can you please, this is my last question, if you can elaborate on the Tushy method, because that's yours and yours alone. So if you can introduce our audience to it, I'd appreciate it.
Absolutely. So the Tushy method is basically a way of getting your fertility checked. And it's 5 basic steps. And you can do all these tests in one menstrual cycle. So I'll just kind of go through it. It's very straightforward. So when your period starts, you call the doctor. And on cycle day 3, they can do all the blood tests and the genetic tests. So they can do the FSH, estradiol, AMH, and all the preconception labs that we usually do, like thyroid, vitamin D, prolactin, blood count, blood type. Make sure your immunizations are up to date. For example, check your varicella titer, your MMR titers, and then do your carrier screen and chromosome analysis if that's something that applies in your case. Then you would go in for an ultrasound. They would look at your uterus.
That's the
Okay?
U. So
That's the
U.
U, right? And at the same time, you order the sperm kit. So you can go to my website and just click on it, and you can see there's a little drop down that says semen analysis. So you order the kit to your house. I know not everyone's in a heterosexual relationship, so if this doesn't apply to you, don't worry about it. But you just order the sperm test, put it in the cup, and then ship it off. And then you wait for all the results to come in. And that's how you figure out everything in just one menstrual cycle. That's how you can get your tushy check. By the end of the month, you'll basically have all your results back. And then you can kind of sit down with your doctor and talk through the plan. Talk about how many kids you want, how old you think you might be when you have your youngest. Should you freeze eggs? Should you freeze embryos? Should you freeze sperm? What supplements you should take? Those are the kinds of things that you want to talk to your doctor about even before you start trying.
I love that. It's taking such an empowered and proactive approach to fertility and, your choice of family or not, so that's great. I love that as women, we're talking about this a lot more. And you're sharing all the information that you're sharing and doing the education. I think it's so important for our time. Where can people find you, and any final thoughts?
You can find me anywhere that you can put Egg Whisperer in a search bar. So I'm very easy to find. So on YouTube, I have classes that I run through the Egg Whisperer School about fertility, about egg freezing and IVF. And I invite anyone who wants to join my next class. They're a fun way for me to teach people about fertility. And I get to hear questions and people's stories from all over the world. So I look forward to meeting you if that's something that you want to join and do with me.
Thank you so much, Dr. Aimee. It's been so awesome chatting with you. And I hope that you guys have enjoyed this conversation as much as I have. Go follow the Egg Whisperer. And until next time.
Thank you, Salome.
Thank you.